Good evening. I'm here today with Dr. Lee Voulters, who has served as past president of Mississippi State Medical Association. He has been a true leader in organized medicine, both on a state level with MSMA and on a national level with American Medical Association. So, Dr. Voulters, thank you so much for your leadership and service throughout your time. I know you're a practicing neurologist in Gulfport, Mississippi, and times have changed now. You're starting to see a lot of your patients through telehealth. So, would you be willing to share a few tips on telehealth and some great resources to go to for physicians who are now looking to telehealth to see their patients?
Yes, of course, and thank you, Abney, for having me on here. Yes, as you know, I have had experience with telemedicine for a long time now through our telestroke system. But of course, as we're all experiencing now, healthcare providers in Mississippi and across the country, we're experiencing, that our exposure to patients live is very limited, and so more and more we're having to turn to the telemedicine platforms. And there's a lot of platforms out there. I personally am not a big fan of phone only. I really like the video audio platforms. Phone only, really, especially as a neurologist, as a specialist, I really don't get a good idea of what's going on. I like to see the patient. I'd like to know who I'm actually talking to. I mean, anyone could be on the other end of the phone and say, I want a refill on my narcotic prescription or some controlled substance, and you don't know who you're talking to. But if they are sick and if they have symptoms, being able to look at them, even if you're not in person, you can have a really good idea of what's going on and what's happening. So there's a number of platforms which I think are very easy to get hold of. I mean, FaceTime is very good. I think Zoom, which is what you and I are on now, is a good platform. DoxyMe for people who do not have iPhones or iPads is a good platform. Then there are a number of out there. And they're very easy to use. You log on to the website and they talk you through how to get on the system. It's very important to have a good staff to help you with this. What I do, my nurse will get on with the patient first, and first of all, make sure this is the right patient. They ask their date of birth, and then we pull up the electronic medical record. We go through their medications. I talk to the patient, and we work out what the problem is, what medications they're on, what they need, etc., etc. And then we document. I just have a normal electronic medical record with that, with a couple of changes. We have to have some sort of telemedicine consent, which we talk about both with the patient and then in the electronic medical record. And then there is some sort of documentation about this is a telemedicine recording, and that we have the patient's consent, etc., how many minutes, etc. But again, the internet is a wonderful place in many respects, and you can get templates on the internet. You can make up your own. You can get suggestions and templates on the internet to tailor it to how you want to say those things and document it in your electronic medical record. And of course, there's wonderful resources. The State Medical Association have been huge proponents of audio-visual communications and telemedicine for a number of years. We've got wonderful people like you, Avni, who help us and guide us throughout this. The AMA are wonderful resources. I mean, they have a wealth of experience and have taken best practices from all over the country, and they have great systems on the website. And what I should also say is reimbursement. As most of my colleagues know by now, that in all insurance companies, CMS, all insurance companies have made special concessions now with the COVID pandemic, and they've relaxed a lot of the guidelines for E&M, for electronic billing, for documentation, etc. And they have published new fee schedule guidelines. And again, you can go on to the CMS website and to the individual Blue Cross website, Aetna website, etc., and you get more information about coding and charges, etc., and what your regulations. So the information is out there, guys. You just got to look for it. But you come up with a system that works for you, and it can be very successful. And the patients like it. The patients really, really like it. They really enjoy it and interact, and it's working very well.
Thank you so much, Dr. Voulters, for sharing your firsthand experience and all of the wealth of knowledge and the tips that you have gained throughout this experience. I know this is a difficult and uncertain time, but we appreciate your leadership and for you to continue giving back to physicians, your community, and the health of Mississippians.
My pleasure. Thank you, and take care and be safe, everybody.